अखिल भारतीय तृणमूल कांग्रेस AITC के विधायक HM शांपलियाग ने राज्य सरकार से सवाल किया है कि सरकारी स्वास्थ्य क्षेत्रों में काम करने वाले डॉक्टरों, नर्सों और स्वास्थ्य कर्मियों की इतनी बड़ी संख्या को अभी तक COVID-19 के खिलाफ टीका क्यों नहीं लगाया गया है। राज्य विधानसभा के चालू बजट सत्र के दूसरे दिन प्रश्नकाल के दौरान यह मुद्दा उठाते हुए उन्होंने कहा कि IIPH शिलांग द्वारा किए गए अध्ययन की रिपोर्ट के अनुसार 93 डॉक्टर, 468 नर्स और 434 गैर चिकित्सा कर्मचारी कार्यरत हैं। सरकारी स्वास्थ्य केंद्र जिनका अभी तक टीकाकरण नहीं हुआ है। उन्होंने कहा कि हालांकि निजी अस्पतालों में स्थिति थोड़ी बेहतर है क्योंकि इस रिपोर्ट के अनुसार केवल 43 डॉक्टर, 144 नर्स और 147 गैर चिकित्सा कर्मचारी हैं जिनका टीकाकरण होना बाकी है। शांपलियाग ने कहा कि वह जानते हैं कि सरकार जागरूकता पैदा करने की कोशिश कर रही है कि COVID-19 के खिलाफ लड़ाई में टीकाकरण महत्वपूर्ण है। TMC विधायक ने कहा कि सरकार भी लोगों को खुद का टीका लगवाने के लिए मजबूर कर रही है और साथ ही डॉक्टर और नर्स अभी भी वैक्सीन लेने से हिचकिचा रहे हैं। शांपलियाग ने कहा कि लोग सवाल कर सकते हैं कि अगर यह चलन है तो उन्हें टीका क्यों लगाया जाना चाहिए। इससे पहले स्वास्थ्य मंत्री जेम्स P.K. संगमा ने बताया कि सरकारी स्वास्थ्य केंद्रों में 2456 स्वास्थ्य कर्मियों का टीकाकरण होना बाकी है जबकि निजी अस्पतालों में 48 स्वास्थ्य कर्मी हैं।
Mr. Speaker, sir, reply to start question 3. A. Sir, the total number is 2,505, which is about 10% hesitancy rate. B. Sir, based on the study conducted by the Indian Institute of Public Health, IIPH, Shillong, there are various reasons for COVID vaccine hesitancy among the healthcare workers. C. So the total number of unvaccinated healthcare workers in government hospitals is 2,456. D. So the total number of unvaccinated healthcare workers in private hospitals is 49. E. So the government is making all-out efforts to conduct counseling and create awareness programs in this regard.
Yes, Vahimala. Mr. Speaker, sir, may I know from the Honorable Minister, what is the total number of health workers that are targeted for vaccination?
So the total number is 28,708 healthcare workers, sir, which are serving in government hospitals and 2,000 in government hospitals, sir.
Does that include the ASHAs also, sir?
Yes, sir.
Honorable Speaker, sir, I am privy to a report in my hand which has been conducted by the Indian Institute of Public Health, Shillong. Sir, this survey has been conducted in 4 hospitals, sir. So out of these 4 hospitals, there are private hospitals and the government hospitals. The report says that there are 93 doctors who refuse vaccination in the government hospital. Then there are about 462 nurses who refuse vaccination. There is about 434 non-medicals in the government hospitals. And when we look at the private hospitals, sir, we have only 43 doctors who are hesitant and nurses only 144, non-medical 147. So this picture shows that the hesitancy rate for vaccination is more on the government hospitals and the government health workers rather than the private. And the minister's reply itself shows very clearly, sir, in C and D, that the unvaccinated in the government hospitals is 2,456, whereas in private hospitals is only 49. So may I know the reason, sir, why there is so much of hesitancy among the government health workers, sir?
Mr. Speaker, sir, So there are various reasons I might mention in the course of my reply. And as per the report of the Indian Institute of Public Health, the IRPH, sir, this was a report via a study which was conducted among healthcare workers and the community. So I will just read out the reasons why people are hesitant to take the COVID-19 vaccine, sir. So one, some people are worried about the side effects after vaccination, and this is in descending order of priority, sir. Number two, sir, messages on social media that cause concern. Number three, sir, some of them have not yet decided which vaccine to take because there are many choices of different companies which are on offer. So number four, some of them feel that natural immunity is sufficient. Number five, sir, some of them are confused by different messages from different sources. Number six, sir, some feel they have developed immunity against the virus. Number seven, sir, some fear needles and the pain caused by needles. Number eight, some fear that the COVID-19 vaccine may affect future pregnancies. Number nine, so none of their friends or relatives have taken the vaccine, so they feel that they shouldn't also. Number 10, COVID-19 vaccines are not safe. This is, some people feel that it is not safe. Number 11, sir, family members sometimes advise them not to take the vaccine, so they go by that advice, sir. Number 12, COVID-19 vaccine causes infertility and impotence that is felt by some of the people, and that's why they are hesitant to take the vaccine. Number 13, sir, they feel that COVID-19 infection is not serious, so vaccine is not important. And number 14, lastly, sir, influential leaders do not support the vaccine, thereby they feel the need for taking the vaccine does not arise, sir. So these are the reasons which were spelled out in this report conducted by the Indian Institute of Public Health, and I hope that answers the question.
Mr. Speaker, sir, we understand how important vaccination is against this dreaded disease, COVID-19, sir. And we also understand how much the government is spending a lot of money in creating awareness, publicity. I could see a lot of pamphlets, posters, hangouts, hoardings, asking the people of the state to go for vaccination, sir. Now, when the government on one side is asking the people to go for vaccination, they're forcing the people, they're going door to door and asking the people to come for vaccination. Now on the other side, sir, it's so glaringly shown that the health workers, even the doctors and the nurses are still hesitant, sir. Now, sir, what kind of picture are we showing to the people? That when the doctor himself is hesitant, then the public would say, when the doctor is not taking the vaccine, why should I take the vaccine? Now, I'm not here to propagate against the vaccine, sir, but I'm trying to draw a picture giving a contrast of this whole scenario, sir. Therefore, sir, I understand the situations and the reasons that the Honorable Minister has specified just now. Yes, there are genuine reasons like that. But, sir, I see in the last answer, in C or E, that the government says that they have made all efforts to conduct counseling, create awareness program for such hesitant health workers. Now, may I know from the Honorable Minister, sir, how many such health workers have changed their mind and taken the vaccines?
So it's an ongoing process, and how many have changed, to put it into context, sir, will require a certain timeline which I think the honourable member, if he so wishes, I can provide that.
Sir, may I just, okay, I wouldn't like the total figure as how many, I'll just rephrase it, sir. Like, what is the kind of percentage that the Honourable Minister could give us, that what is the rate of change of mind that is going on? Whether their mind is still stuck not to take the vaccine, or has it changed after the counselling and the awareness program done?
Yes, sir. Definitely, sir. Counselling has helped to a large extent, sir. And we have seen behavioral changes in people due to these counselling sessions, sir. And this is an ongoing process, sir. As you know, as we speak, a lot of people are coming forward to take vaccines. This is something that we are not, discontinuing with that process of counselling, so that people, whoever so wishes, can keep coming, sir. And I would say, sir, 70 to 80% of people who were earlier hesitant to take the vaccine have come forward and have come forward to take the vaccine. So